So when we look at the different branch points from the aorta, the first branch of the aorta is actually the coronary arteries. This is a common trick question that NCLEX will throw at you. So that is the first branch point. From there, your aortic arch, you need to know your ABCs. And we're looking at like really the things that branch off this aortic arch here. So first one, coronary arteries, right? And then what's branching off from there. So this is your know your ABCs. You have your brachiocephalic trunk that leads then to the right subclavian and right common carotid. Okay. Brachiocephalic trunk, right subclavian, right common carotid. All right. Then left common carotid, then left subclavian. So left common carotid, left subclavian. So that's our key. That's our know our ABCs. High yield stuff. The ligamentum arteriosum is a remnant embryologically of the ductus arteriosus. This is connecting the aorta to the pulmonary trunk. It was a shunt that when you were growing in utero as a fetus, you were able to communicate or allow for blood and oxygen and stuff to move directly from the left side of the heart to the right side of the heart without having to go through the lungs. Now, the other kind of key branch point off besides the ABCs is knowing kind of your key landmarks off of the abdominal aorta. And I do have a picture here because we're going to also look at GI blood supply, but this is your abdominal aorta. So branch points off the abdominal aorta or key landmarks, you're going to have T12 is your aortic hiatus. That's when the aorta enters into the abdomen. It's also the origin of our celiac trunk off of the aorta. L1 is when the superior mesenteric artery, the SMA, branches off. L1 and L2 is the renal arteries, the right and left renal arteries. L2 is also the gonadal arteries, ovarian or, testicular, depending on the anatomy of the person. L3 is the inferior mesenteric artery, the IMA, and L4 is the bifurcation, when it bifurcates into the common iliac. It's typically around the belly button, so just for having an idea. The rule of the GI arteries is if they are single, they're coming out interiorly, like out at you off the page. And if they are non-GI arteries, they are paired and they're either lateral or more posterior. Okay. So looking at this picture here, you can see celiac, superior, and inferior mesenteric. These are the three GI branches. They're coming straight out at you. Versus these other branches are paired and they're coming out to the side laterally or maybe actually even posteriorly. So what are our kind of GI blood supply high yields? We have our celiac trunk at T12L1. This is going to supply structures like the lower esophagus, the proximal duodenum, the liver, the gallbladder, the pancreas, and the spleen. And this comes from the foregut region embryologically, and it's innervated via our vagus nerve. Our superior mesenteric comes off at L1. It's the distal portion of the duodenum and the proximal kind of 2/3 of the transverse colon. This comes from midgut, also innervated by the vagus nerve. And then we have our inferior mesenteric artery, L3 origin, distal latter portion of the transverse colon, also the upper anal canal. This comes from hindgut, and this is the pelvic nerves, S2 through 4. Okay. Now, there are some things that have dual blood supply. Our splenic flexure is going to be duly supplied by the superior and inferior mesenteric. Our rectosigmoid junction is also duly blood supplied with our inferior mesenteric and the superior rectal artery. And our inferior vena cava is going to move through the diaphragm at T8. And this is formed by a kind of a confluence of right and left iliac veins at L5. So right and left iliac veins confluence together to become the IVC. IVC moves up the diaphragm at T8. Again, key anatomical distinctions. You can kind of see some of these pieces here. All right, we're gonna pause. When we come back, we're gonna look at a little bit of like the high yield blood supply of these other organ areas in the body.